Good morning and Ramadan Kareem. Welcome back to Flexwell. Hope you guys enjoyed the segment at the gym. Today I am joined by Fatemah Alshatti, who is a hand therapist and physiotherapist. Fatemah, welcome to the show.
Thanks for having me.
It's wonderful to have you. How have you been?
Alhamdulillah.
Today I thought we could talk about something that can be exacerbated during Ramadan as well as in general, which is trigger pain in your fingers, I think. Is that correct?
Trigger finger.
Trigger finger, yes, that's what it was.
Yeah.
So could you explain to us what trigger finger is?
Okay, so trigger finger is like when you close your fingers, when you bend your fingers, one of the fingers will get locked. So it's like locked, then click and opened again. So what happens, it is in trigger finger, it's there will be like a blocking on the tendon passage around the tendon sheets. So there will be like a noodle, okay, that will block the movement. So when you bend your finger, the tendon will be pulled. So when that noodle is there, so when you extend, when you open your finger, it will block that movement, to block the tendon's movement. So then we will have that clicking and locking, then eventually opening the finger.
Well, that's really interesting. I didn't even know there was such a thing as trigger finger. And all the lock, even the fact you called it a noodle, it's quite interesting because it's such a fun word, but it's just different context entirely. So what are the kind of things that causes this?
It happens because of repetitive movements. Diabetic patients are more prone to it. Women, rheumatoid arthritis, if you have any previous trauma to the hand and fingers, so actually you're, it's like you may have it as well.
Well, that's good to know. Does the thumb ever get affected as well?
Yes, it can affect all fingers, including the thumb.
Does it cause swelling?
It can be, not always. Not always.
So what are the things people should look out for in terms of trigger finger?
It starts with pain, and sometimes you'll have a clicking sound. Where the pain will be here, at this side here, and you'll have the clicking pain with the hand movements. Even the thumb movements, you'll have that pain. So the early signs of it. After that, you'll feel the movements, it's clicking, it's locking, it's not opening. That's why you call it a trigger. It's like it's closing, then just lock, then back straight.
And does locking, is it considered a serious issue?
Yes, because that will limit your movements. Because if you're holding, when a patient comes and tells us, like whenever I hold anything, it just lock. So it will prevent the normal motion of the hand, the normal movement of the hands.
I feel like that is a terrible thing to happen sometimes. We use our hands for so many things. So would you say that trigger finger can be exacerbated by certain things?
It's repetitive movements. Yes, repetitive movements and overuse, actually one of the main causes of these. So that's why I keep on telling everyone, take care of your hands, take care of your hands. It will not happen now, it might happen later. Diabetic patients may have it earlier on, but other patients may have it later on. It's like maybe 50s, sometimes 40s, depends. But now with the overuse, actually I'm seeing it with younger patients, even non-diabetic patients, because of the overuse.
And is it because we're doing a lot more repetitive movements using phones and tablets and things?
Yes.
So does the scrolling also make this happen?
The scrolling, it doesn't really affect it. It's because you have to like close your hand like this, and this like strong fist. That's one of the motions that will cause it. It's a factor. Scrolling is a factor, but not the main factors. Anything that have like strong grips, that's one of the main factors for it.
And does it cause pain?
It does have pain. It does have pain, especially the locking. The pain differs from one patient to another. The severity of the pain also differs. But I think it's more annoying to them, the locking, than the pain. But pain is there, especially when it's locked and you're about to straighten it. Yes, it's painful.
So when would a person know that this is a serious issue and not just maybe a random hand spasm or something?
Once the locking will happen more than once, come and check. No, wait, come and check.
Early prevention is key.
Yes, early prevention. And some of them, actually, I just also tell them if they're not diabetic, they have to check as well.
So it's quite common in people with diabetes.
Yes.
But not so common in other people.
Oh.
So I feel like we always end up finding out that whatever happens that might seem abnormal, especially if it happens more than once, is the main issue I think sometimes doing something is like, if it happens maybe once, is that considered okay?
Yeah.
And we can like let it pass.
Yes.
So it's only if it happens.
Yeah, you may not notice it first. You may not notice it, but if it happens twice, no, there's something. So why did it happen?
Yeah.
There are other reasons. There are some other conditions that may cause the locking other than trigger finger. But we have to assess and just check if you're having trigger finger or not. Like prevention.
Early prevention is key. So if anyone starts to feel these symptoms, it's best to go seek a professional help.
Yes.
Well, that's really good to know. We are going to take a very quick break, and then I hope we can talk about this a bit more. Stay tuned for after the break. And we're back from that short break. We were talking about trigger finger, where your finger can sometimes get locked or stuck or stiff based on the way that you're using it or holding things for too long. Is that correct?
Yes.
Well, I wanted to ask you, does rest alone ease the symptoms?
No. Rest alone will not ease the symptoms, but actually it is one of the, it's like treatment options. It's like I use splints. So that splint, what? If I'm using this finger, it's locking, okay? So this motion will actually lead to locking of the finger. So when I make a splint, I will lock this motion and just allow the two joints here to move. So by that, I'm actually resting this joint, okay, where the locking happening, and allow the patient to use their hand while it's like also easing that position, giving rest to the tendon, reduce the locking from happening, okay? So this one of the treatment plan options.
Well, that's good to know. Can exercise ever make the symptoms worse?
It's no. What type of exercise you mean? Therapy or gym?
Gym.
Gym, yes. I would recommend them because if you're going to the gym, you're holding weight. There is any chance that the finger will just get locked. As I said, from this locking position, so you're holding the weight like that, it might just get stuck. So you may have injury even for yourself. That actually will also increase the symptoms. At the beginning, we want the symptoms to be reduced, okay, and to allow healing. Then after that, we can just slowly go back to gym.
Okay, I feel like that does make a lot of sense. And before going back to gym, is it best to seek professional help?
Well, yes. You have to.
Is there a time when people should know when to seek professional help? How can they tell that they have trigger finger?
Once you have pain, once you have clicking, the pain will be at the side. So once you have pain here, when you're moving your finger, when you feel your finger a bit stiffer than usual, when you hear clicking sound, when you close, you bend and open your fingers, come and seek professional right away. So actually people who comes earlier for treatments, they have a really good chance of not full recovery, but good recovery. Because it's also trigger finger can come and go. We cannot treat it fully. Depends. We can manage the symptoms, okay, but the symptoms can come back once you stop your exercises. Yeah.
So best not to stop your exercises.
Yes.
Well, that's really good to know. And you mentioned that there are a lot of treatment options.
Yes.
What are they?
Okay, so as I said, because it's all happened because of that noodle and the lump is here. So what we have to do, we have just focus on reducing the size of that noodle. We can go to different also machines, equipments. We have the laser therapy, high-level laser. Why? Because we use heat to reduce the size of the lump, thus reducing pain, reducing symptoms. Okay, we use splint to also blocking the movement and allow the patient to use their hands. But also for the splint, we shouldn't wear it for a long period of time because on that we have also stiff finger. Other options we have strengthening exercises and stretching exercises. When I say strengthening exercises, I don't mean having a ball and going like this, strengthening the bending of the fingers, because that will increase the symptoms, because it happens because of the overuse of bending. So we will strengthen the back muscles, the muscles that straighten our finger, and stretching exercise will also go backward.
And people should always implement these activities for their hands?
Yes.
Is it in general or only if you have trigger finger?
Some exercises actually you can do them even if you don't have a trigger finger. Some patients of mine can see the signs of if they're diabetic. Actually, I would tell them right hand, do these stretching exercises as a preventive. It's a good exercise. It will not harm you in any way, and it's good for you.
And as we've always said, early prevention is key.
Yes.
So what's the recovery time if you do struggle from this?
Depends on the patients. As I said, they're diabetic. I will check, are they taking their medications on time? Is that the glucose level, diabetes level is controlled or not? That will also affect the recovery. Uncontrolled ones is tricky to treat. I actually focus on diabetic patients because they're the tricky ones to treat, but not always, but they're tricky ones to treat. The ones that happens because of trauma is the easier one to treat, but not always conservative management help, as in physiotherapy. Sometimes we may need to go to cortisone injection. Sometimes we go to surgery. Depends on the severity of the case or the patient himself.
Well, that's really good to know. I want to thank you for sharing all this wonderful advice with us.
Thank you.
And thank you for joining us today. I hope you guys learned a lot about what trigger finger is and how it can happen from overdoing certain hand movements. If you have any clicking or locking of your fingers or any pain, please seek professional help. Early prevention is always key. In general, try to do strengthening and stretching exercises. Even in general, it helps your hands. If you do find that you have a problem, go to your physiotherapist or doctor. They will give you proper exercises, which you should listen to and always follow their advice. And hopefully you can make a full recovery. That's all we have for today. I'll see you next time.